Hello. So it's been a little bit since I've managed to do a video, and I don't know where my camera is. Oh, okay. And my light is bad on me. Oh well. It is nighttime. I had to wait for my kiddo to get to all the way to sleep, and he was awake for over an hour in his bed. So, really impedes my my plans. It has been officially 2 months on August 26th. It is now August 28th, so it has been 2 months, but it has also been now 9 weeks since my Chiari decompression brain surgery, which was June 26, 2020. So I wanted to do an update, and hopefully it won't be 25 minutes long like my what to bring to the hospital video, or what I brought to the hospital video. To start with, I wanted to mention symptoms. So there's a lot of symptoms of Chiari, and there's a lot of symptoms of Chiari that also overlap with other things, like Ehlers-Danlos syndrome, tethered cord, migraines in general. There's a whole bunch of things that can overlap with that. Cranial cervical instability can be another thing that has symptoms that overlap. So I'm not going to go over all the symptoms, but so far I have noticed that I've had a decrease in my high pressure symptoms. So high pressure, as in the cranial cervical fluid around my brain, was too great because my cerebellum was acting like a cork and just trapping it all in there. There could be other reasons as well, and I'm hoping that if I need to, I can look into more reasons. So my high pressure symptoms were basically gone until 6 weeks post-op. I was super excited about this. I was really hoping that they would stay gone. Before surgery, I was waking up almost every single day with like a pressure headache. It's hard to explain. It's not like a tension headache, and it's not like a migraine. It's specific to this high pressure. One of the things they call the high pressure, they call it IIH, or idiopathic intracranial hypertension. So intracranial hypertension. I also get low back pain from this, and like a pressure feeling coming, like my sinuses are just like being compressed. It's not mold, it's not allergies, it's not congestion. It is the pressure from the fluid in my brain pressing into the back of my sinuses. And I also sometimes get a whooshing or tinnitus in my ears. Sometimes there's a high-pitched noise, but more times than not, it's a whooshing sound in my right ear. Those were all gone, and now are kind of creeping back up again. My low back pain isn't as bad. I've only had a couple times when I've woken up with a pressure headache and it's gone away. So kind of hoping that might help. I'm going to try a tea habit. Get a little caffeine in me in the morning and see if that might help with the pressure feelings. Let's see. So far I have had 19 migraine days at least. I might have missed a few because post-op there were times when it felt like I had a migraine, but I wasn't sure, and my pain was just so intense that I don't actually know. I might have had a true migraine as well. So these are migraine days, headaches, Chiari headaches that turn into migraines, all of it. I don't break them apart into what they are because it's really hard to tell. Today counts as day 19, but I was able to take my migraine medication really early on, and it's mostly helping. So my migraine pain and light sensitivity is down really low right now, whereas it was starting to creep up, and I was like, I'm just going to take the medicine and try to stop. So so not a big decrease in the number of migraines pre-op to post-op, but I am hoping. August was really low numbers, I think 5 or 6 in all of August, whereas normally I have 10 to 15 in a month. So I'm really hoping that this is a trend in the right direction for the migraines and headaches in general. I did have one of these migraines a couple of weeks ago that turned into an emergency room trip. I started throwing up. I couldn't stop throwing up. I couldn't eat or drink for close to 24 hours. Ended up going to the emergency room. It had to wait for 3 hours before I could get seen. Once the medicine and the IV fluids were in me, I was better within an hour. So I'm really grateful that the medications and the fluids do help me, because there are a lot of people who it doesn't. They just suffer for days and days on end without any relief, and going to the hospital doesn't help. And it would be kind of nice if I had a way to do IVs at home, but I don't have that, option. And having that option, I think, is complicated and medically tricky. So it would be nice just to be able to do IV fluids as soon as I start to get a migraine and throw up. I don't throw up very often, so it's been kind of crazy. Let's see, my gait and weakness have decreased, but I also haven't been very active. I have noticed there have been times when I do feel like I can't, my left leg just like collapses underneath me. I don't know the name of the toy, but there's a little wooden toy that's got a little figure made out of beads and a base that's wooden and round usually, and you press it. It's like an old-fashioned toy I'd find in little shops sometimes, and the whole thing just like collapses because there's no tension on the elastic anymore, and that's kind of what it feels like with my left leg when I walk. Sometimes it just feels like my left leg just collapses underneath me. There's no rhyme or reason to it. I couldn't recreate it for you. I can't make my body do it. It just happens sometimes. It was really bad in December. It was a really stressful time dealing with diagnosis, dealing with school classes for myself and my child, dealing with migraines and illness in general. And then on top of all of that, I was just super stressed out. The week around Christmas, I could barely walk. It was pretty bad. I also have leg pain, which had been gone for the first 5 or 6 weeks. So every time I wake up, it's just like my feet ache and hurt. And it's not rheumatoid arthritis. It's nothing like that. It's got to be connected with Chiari malformation and high pressure and stuff like that. And I don't know if I have a tethered cord, so there could be that going on as well. It can also be related to Ehlers-Danlos syndrome. Having hypermobility can cause stiffness and pain, which seems counterintuitive there, but I don't know a whole lot about why that happens yet. It's been so overwhelming. I haven't been able to do the kind of research, especially with my brain. Speaking of, real quick, with I have word issues, which have been okay the last few days, interestingly enough. Sometimes I just can't get the word to come out, which I learned recently from an audiobook that it is called aphasia. Sometimes it's called semantic aphasia or verbal aphasia. Sometimes I just cannot find the word. Sometimes I just automatically put a different word in place. So like I was trying to tell my child to put something in the microwave, and instead I said garage. They're both boxes with a door you put things into. But things like that, or I'll say desk instead of table. Those aren't as hard as when I just really cannot even find a word. That's really challenging for me. I've had a lot of problems even with typing at times where I'm writing and I'm pretty into words, pretty into grammar, and I'm not perfect, but I do like to make sure I'm speaking and writing properly. And I'll switch words like the different theirs, or words that sound similar, or words that sound the same but spell different, mean different things, and I'll put in the wrong word, and I'm like, this is weird, because I'll even go back and proofread it, and I don't catch it, and that's challenging for me. So that's a problem I have had for over a year now, and was one of the reasons I really pushed to see a specialist, because I felt like these changes were not just migraines, and these were bigger deals. Okay, pain, fatigue. I don't know how much of my fatigue right now is from recovering from surgery and how much of it is just the condition itself. Which can be exacerbated by surgery and things. There's a lot of swelling, there's a lot of, so you can get scar tissue and things like that. So I don't know what's all going on, but I'm pretty fatigued and exhausted. My activity level, I have to rest a lot. I have to, I'm easily worn out, so I still plan what I'm going to do each day, and try not to, bite off more than I can chew. So if the goal used to be maybe like one activity a day, and I'd have to do a lot of laying down and resting, I try to do like 2 things a day. And that by activity, I mean standing and washing dishes and giving my child a shower, or putting away laundry and showering myself. Those are pretty big deals. I've now been able to add in a little bit more sitting down activities, and I haven't done as much lying down. My sleep is a little better. I don't know how much of that is taking a muscle relaxer before bed. So I am waking up maybe one time a night usually. I'll get about a good 5 or 6 hours of sleep, wake up, go to the bathroom, go back to bed, and get another couple of hours usually. But we just had some big storms come through, and I had, my cushion is slipping, and I had, thunder waking me up multiple times. So that's been interesting. That migraine that I had was, that ended up at the emergency room. I ended up getting, a couple days after it, I ended up getting a lot of fluid feeling on the back of my neck, and it was really disconcerting. I was quite concerned about this. I was able to get a hold of the nurse of my neurosurgeon. Felt a little bit dismissed there, but I also know that they try not to get people totally freaking out. I had been told, it could just be nothing, which I had somebody feel it and check it for me as well, and she agreed that it didn't feel like muscle, that it felt like fluid. And she's a massage therapist and has worked on me and helped me with things before in the past, so she knows what muscle feels like versus something else. So I felt a little bit dismissed, but I've decided if it was a cranial cervical fluid leak, which can form a pseudomeningocele, sorry about that break. There was someone pulling into our little parking lot, parked in a weird spot, walked through the dark. It was kind of freaking me out, so I had to check it out. And freaking out my cat too. But she's being brave. She's being brave going by the window. She's a very shy little girl. So anyway, so I was concerned that it could be a pseudomeningocele, which can be really, really bad. I was getting positional headaches, which means when I was sitting up and doing things, I was getting a headache, which felt different than my normal stuff, and I was getting nausea from that as well. So I decided, after not really getting a whole lot of guidance from the nurse, just to lay down as much as possible for those few days. And I was still recovering from the migraine as well, and the fluid loss and stuff. So the other option possibility is that it could have been a seroma, which is when an area is injured, fluid goes to that area to help protect it. So when I threw up from that migraine, it was very painful. I had a lot of jarring, and it hurt really bad. I even had a lidocaine patch on at the emergency room, which was quite good. I thought maybe it's not doing anything anymore. Maybe it was the medication they gave me, and that helped. Took off the lidocaine patch before I left the ER, and I was within 5 minutes I felt some of the pain come back. So that was really interesting. I'd never had a lidocaine patch before. This fluid buildup, whatever it was, that I could feel under and in my muscle, did diminish and go away on its own. I feel like it's 95% gone. I can kind of feel a little bit. So that's reassuring. It went away. It did not develop into a large mass like a pseudomeningocele would have done. So that was good. Let's see, I talked about other activity level things, because I said about resting a lot and getting worn out really easily, is I still do not lift anything if I can help it. Probably the biggest, heaviest thing that I deal with lifting is my cast iron pan. I use a big cast iron pan for cooking, and I keep it in my oven and then lift it out, or if I need to wash it, I have to lift it over the couple feet to the sink. I try not to lift anything if I can help it. So I'm not lifting laundry baskets, lifting piles of things or boxes of anything if I can help it. If I do need to do something, I get help from my kiddo if he's able to. I do have a decrease currently. The last week or so, I've noticed when I lean forward, I'm not getting as much pain. I'm not feeling a rushing feeling into my brain. So those are both good. I'm glad about that. My incision is looking really good. I have had no issues with my incision. It looks amazing. I had to get my hair cut in order to be able to get onto there more with the scar treatment. And I have used a healing balm, vitamin E oil, and scar guard. Those are the 3 things I've used so far on my scar. The incision, I was told 3 weeks was what my neurosurgeon told me because things were healing up really well. She said wait until it's completely sealed, give it to 3 weeks, and then to put it on. So I don't want to take that as medical advice for anybody. I would always check with your surgeon for anything like that. What is okay? The reasoning my doctor said to wait for 3 weeks was to make sure that it was sealed up because those vitamin E oil and scar guard are not, what is it? No germs in it. It's not sanitized. It's not, I'm blanking on the word. So that was good to know. Medications. When I was discharged from the hospital, I was on Robaxin, which is a muscle relaxer, 3 times a day. I was on Norco 5s, which was 4 times a day, and I was on ibuprofen, 2 pills of them, which I think is like 800 milligrams, 3 times a day. I was able to stop the Norco 5s on, I think, July 3rd. I've had to use them occasionally since then, like 3 or 4 times. Unfortunately, I developed a GI bleed 3 weeks or so into my recovery, which caused me to start throwing up violently for 24 hours. Couldn't keep anything down. That was a Sunday. Ended up at the emergency room. They didn't piece it together. My hemoglobin was down to 9.3 or something like that, but it was, and it should be 12.5 to 15, I think, for women. So my hemoglobin was decreased and it was not good, but we missed the pieces. I was thinking I might have been having an adrenal crisis or something scary that was super emergent. A GI bleed is also emergent. I got medication. My body kind of came out of the shock that it was going into. I was shaking and it was really bad. Then that Monday I was feeling okay, and then Tuesday and Wednesday I started feeling worse. Oh, got an alarm there. Tuesday and Wednesday I started feeling worse, really, really slow, really like barely able to walk. I would walk like 3 or 4 steps and then my knees would buckle, different than my gait issues. Like I just could not stand up anymore. I would collapse on the floor, crawl places. It was pretty scary. On Thursday, like 2 in the morning, I started throwing up again. I still did not know what was going on. That's when I thought it might have been an adrenal crisis. So I was freaking out. As soon as I started throwing up, I took Zofran, which I also had from the hospital, for nausea. Went to bed. When my son got up, I had him help me start getting packed. Packed a bag for him, packed a bag for me, got a hold of my mother, and she came up and got him, dropped him at a friend's house, took me to the emergency room, and then got me settled in and waited with me for a while, and then got my kiddo for a couple of days. So at the emergency room, this would have been a Thursday, I started GI bleed on Sunday, and it turns out my hemoglobin got down to a 5.3, I believe, before they were able to give me a transfusion. So I ended up getting a transfusion. I was admitted for 2 nights to the hospital. This is going to end up being a really long video too, but hey, it's a big update. And it was a very rough go. I struggled. Struggled eating. I had a scope done to check, and they said, yep, there was ulcers that they found. By that point, they were done bleeding, so they didn't do anything while they were in there. They did take some samples just to be sure, because I think there's a bacteria or something that can cause GI bleeds, and so I have yet to hear how that went, but I figure if that had been positive, they would have called me. They think that the GI bleed was caused by the ibuprofen. NSAIDs, which are non-steroidal anti-inflammatory drugs, can cause GI bleeds. What really blew my mind about this was that I took ibuprofen and naproxen for years, sometimes alternately, sometimes at the same time, rarely on a full stomach, sometimes, like with absolutely nothing. I could wake up in the middle of the night, take ibuprofen, and not have any problems. So it's really, really crazy to me that I ended up getting a GI bleed from this. So I don't know what other factors there were in this perfect storm that caused it, but it was pretty crazy. And I did take my medicine with food every single time, even if it was 5 pieces of cereal. Like, I always put something in my belly with it at the same time. So that has taken a while for me to recover from. I had my follow-up blood work done about a week ago. I don't remember all the dates. And it was after my emergency room trip. And my hemoglobin was only up to a 10 point something. So improving, but it wasn't there yet. So back to taking my iron. So currently I am taking Robaxin, the muscle relaxer, 1 to 2 times a day. More often than not, I just take it right before bed. Like, I'm pretty stiff right now, and I'm just holding off until I'm done with my video. I take Tylenol as needed, but it doesn't do much at all. So every once in a while, I've had to take the Norco for pain. And I have been taking Maxalt, which is a migraine prescription, which can only be taken 10 times in 30 days. So when I was getting migraines more than 10 times a month, I couldn't take the Maxalt every single time. And every single time it didn't work either. So if it didn't work, felt like throwing it down the toilet. It was pretty ridiculous. I am also taking CBD oil, magnesium, iron, and fiber supplements. So those are kind of just what I'm doing to try to keep things going. And I've always taken magnesium. It's helped me with my headaches a little bit, muscle issues a little bit. Let's see what else I put down there. I covered all of that. Look at that. Okay, great. So the only thing I have left to update on was my range of motion. So I want to show you my range of motion. And this is no muscle relaxers. It's been almost 24 hours, I think, since I had a muscle relaxer. So I go to the left and the right. Feels pretty stiff, but I do okay. And then I go down to the ear. Oh, that's really stiff there. Don't even want to go right. And then I go back, which is much improved going front to back. It feels really good. And then there's also these are kind of the exercises we do, but also supposed to do like shrugging shoulders. And then I will also do kind of a quick but not full range. So kind of just getting a little feeling. This is kind of what was getting me when I was driving. So if I had to look really far over my shoulder, I would come back to center and go, oh, my stomach didn't feel right. So my range of motion is doing really well. I have been driving a little bit. The first handful of rides in the car were really sensitive. The vibration of the car plus Michigan roads was terrible and just hurt really bad. Now I can handle driving, but I try to keep it under 10 minutes each direction. And I will specifically take roads that are known to be a little less terrible. So I might choose one road over another because one's really bumpy and really torn up and the other one's a little better. A little nausea, yeah. So, but when I do hit like railroad tracks and things, those hurt, and big bumps hurt. There's some roads that I think buckle a little bit from ice and stuff, and there'll be like lines across the road that are bumps. It's like one bump and then another bump and then another bump, and it's just... So those can be pretty intense. I did do my first freeway driving yesterday, my first highway driving. So and that was pretty hard, and it was 20 minutes each direction. So it was one of the longest drives I've done, and the drive home was fine, but it was at the end of the day, and I'd been upright all day for hours. So it was a bit of a challenge, but that is everything I have written down for my 2-month update. And if somebody listening or watching later has any questions, feel free to leave a comment. Every person's diagnosis is different, their symptoms are different, their surgery is different, their recovery is different. I feel like I'm recovering pretty well, even despite those bumps that I've had from the GI bleed and the migraines and things. But I've heard people doing much worse than me, where they are still in bed, 40 or 50% of the day at 2 months out. So I'm really grateful that so far I'm doing okay. I'm able to handle a lot of stuff that I was expecting I wouldn't be able to do at this point. So don't compare your recovery to anybody else, but it can be nice to check in and see what it's like for somebody else, what it's like for a lot of people, and kind of get a broad idea. to compare, but more to keep things in perspective than to go, oh, I should be at this place, or I should be able to do that. Just because I can do something, or just because somebody else can do something, doesn't mean that it's going to be the same for you. It's so different and so varied, and there's so many conditions that can impact recovery, and it's just you can't compare too much. So let me know if there's any questions or comments, anything I can help with. And I do have playlists that I think are public on my channel. So I've got one for Chiari stories. So if you are recording videos and you want me to add you to my Chiari stories, let me know. And I have one for Chiari information. So when I come across interesting medical talks or interviews with doctors and things like that, I put those in the Chiari info. So Chiari stories, Chiari info, and thanks for listening.